आपका डॉक्टर भैया. Welcome you all to our show, Positive India show, and we have a special guest today, Dr. Anil Goyal ji. He is from IMA, Indian Medical Association. He is the finance secretary of IMA, and he's a very renowned social worker as well as a senior urologist. Here he is, and to talk about some special things on monkeypox. So, even though the COVID-19 pandemic is still not over yet, but there are reports of another viral infection, monkeypox virus, which belongs to the same family of smallpox. And talking to Dr. Goyal ji, straight away coming to the point, Professor Dr. Goyal ji, we welcome you on our show. Thank you very much for coming, and
Thank you.
thank you very much. Namaste.
Yes.
Talking about the monkeypox, there is a lot of disinformation, especially on the social media. Would you like to elaborate some of the queries? Let us start with monkeypox in brief. Would you like to describe monkeypox in brief, and is it a new disease?
Yeah. Thank you, Sumant. First of all, let me thank you for inviting me in this show of News Express. Human monkeypox is not a new disease, first of all. It was first identified in 1970 when the smallpox was eradicated and the monkeypox started. Especially in Congo, in a 9-month-old boy, it was seen in first. And thereafter, it was in Central and Western African countries. But after, say, 1996-97, it went out from the African countries to the rest of the world. Like it went to Singapore, it was found in, say, Nigeria, where it was outbreak of 700 cases. And thereafter, it was found in USA also. Few cases in India also were found in Hyderabad. So now, at this moment, in 2022, now more and more cases are being found in more than 20 countries in all over the world. So it's not a new disease, that was your question. And it started first in Congo in a 9-month-old boy, and then from there it has spread to many countries of the world, especially US, Europe, Israel, Singapore, and of course African countries.
Thank you very much, sir. We would like to remind our viewers that this is an awareness campaign, and nothing to worry, no to panic, but just an awareness program. Coming to the next question, because it belongs to the family of smallpox viruses, many of the symptoms might be same, but would you like to elaborate on the signs and symptoms of monkeypox, and at what point is it infectious?
So first we need to understand that there is incubation period of 6 to 13 days. The incubation period means after being exposed to an infected person, the other person may be infected in 6 to 13 days time. And infection has two stages. One stage is that it is known as invasion period, where patient has intense headache, fever, lymphadenopathy, that is swelling of the lymph nodes, back pain, muscle pains, and intense asthenia, means lack of energy. As we have seen in COVID also, he feels very, very weak. And lymphadenopathy especially differentiate this from smallpox. But in smallpox, there is no lymphadenopathy. And this is 0 to 5 days, which we call it invasion period. Then comes the skin eruption phase, which usually begins after 1 to 3 days of appearance of fever. So what I am saying is first fever, and there is after skin eruption phase. And these rashes tends to be more concentrated on the face and extremities rather than on the trunk, right? And it affects the face in 95% of cases. 95% it affects the face, and the palms of the hand and soles of the feet in 75% of cases. This is important for the audience to know. And also affected our oral mucosa membrane in 70% of cases. It can also be present in genitalia 30%, because this is important because of the sexual transmission. It can be found in 30% cases on the genitalia and conjunctiva 20%, as well as in the cornea. And this rash evolves sequentially from macules, that is flat-based lesions. No? First is macule, and then it papules slightly raised palm lesions, then becomes papule. and thereafter it becomes vesicles, lesions filled with clear fluids. And of course, then becomes pustules, that means lesion filled with yellowish fluid. And the crust will dry up and fall off. The number of lesions varies from few to several thousand severe cases, and lesions can coalesce into the last section of the skin can slough off. You should understand that, or this is also important. Like there may be 10 lesions, they can coalesce and join each other, and then lots of skin may be sloughed. So that's the complication part. So therefore it is very important that timely identification, timely investigation, timely treatment is very important. Though it is self-limiting disease with symptoms lasting from 2 to 4 weeks, but our aim of the treatment would be that we minimize the morbidity of the disease, whether it is weakness, whether it is nutritional issues, or it can go to the lungs also at times, and also large areas of skin may slough off. So therefore, we need to be very careful in identifying this disease early and starting treatment early. That's and the second point, the second question was at what point is it infectious? Obviously, when there is infection, whether it is invasion period or there is skin eruptions, in both cases it becomes infectious because respiratory droplets can cause infection. And the second point is by the touch. If there is a pustule or there is vesicle, body fluids touch, that can cause infection. That is so blood transmission through blood can also cause infection. And of course, this is human to human transmission. Second is zoonotic transmission. That it is also found in say non-human primates like monkeys or rodents, gladies and rats. From there also it can be transmitted by the touch, or there is some infected fluid on the surface of the table. If you have touched it from the fomites, you can. And the fourth, which is debatable, is transmission through sexual intercourse. So because it is found in genitalia also, which is debatable and more research is needed on that. But what is sure is zoonotic transmission, human to human transmission. And the infectious stage is when there is fever, it is infectious. When there is this rash stage of vesicles, pustule, then also it is infectious. That's what it is.
Thank you very much for differentiating from smallpox and nicely describing our viewers with the finer details in simple language. So thank you very much. Now coming to the social sites and many areas, the layman is confusing it with COVID as well. Would you like to? Do you think COVID is related to monkeypox? Would you like to throw light so that the misinformations can be elucidated?
COVID is initially was considered zoonotic also, but basically now it is a human-to-human transmission. And this COVID is a RNA virus. Now it is a double-stranded DNA virus. So these two are altogether different viruses. Therefore, they cannot be clubbed together. So COVID is different. Monkeypox is different.
Thank you very much. According to the latest reports of WHO World Health Organization, more than 550 confirmed cases of monkeypox have been reported in at least 30 countries out of Africa. So, now talking about morbidity, can one die from monkeypox? We have seen reports of death. What is the morbidity and mortality in monkeypox cases?
In the past, we have seen when there were cluster of cases like in Nigeria, there are around 3 to 6% mortality because of the complications, large number of wounds getting infected, secondary infections, or maybe some virus causing pneumonia. But it will always be there in the immunocompromised patients. What is the meaning of immunocompromised patients? Diabetic, obese patients having cardiac diseases, or maybe post-transplant patients, post-chemotherapy patients, cancer survivors, or small children, or maybe small children and the adults, old age patients. And when I'm talking about small children, I would also like to add here that this can transmit transplacentarily also, or from mother to the newborn, or from transplacental, and because of the close contact also. So both may get infected. This is also an important point which the people should know, that it can also, because COVID is considered that it is not transplacental. Initially we thought it is not transplacental, and what we used to do is that the close contact should not be there. Later on it was found that the COVID is not found in small children, neonates. But here it is transplacental also. So the immunocompromised patients, old age patients, children, they can have morbidity, which is to the tune of 3 to 6%, and it was found in Nigeria when there were 700 plus cases and it became endemic. There, mortality was around 3 to 6%.
Thank you very much. Now coming to the point where all the viewers are interested, diagnosis and treatment. So is there any test for monkeypox? Second, treatment for monkeypox, or there is any vaccination for monkeypox?
So diagnosis is first is clinical. Clinical diagnosis means fever with lymphadenopathy and rashes. So this is classical triad of monkeypox. The investigation, as far as the investigations are concerned, the PCR or polymerase chain reaction of this fluid taken out from the vesicle, or maybe biopsy taken from the pustule or vesicle, can give you a result in say 2-3 days time, and you can diagnose it with that PCR reaction, the investigation. But other than that, you have to investigate to find out whether there is bacteremia, other than viremia also. In the viremia, the TLC-DLC will remain normal, while in the bacteremia, the TLC-DLC will go up, which is because of secondary infection. So also diagnosis of the disease and diagnosis of the complications we need to investigate according to the clinical situation of the patient. That is second part. And then coming on to the vaccination of this. The vaccination, the smallpox vaccination, if available, is effective in 85% of cases. But unfortunately, after the eradication of smallpox in 70s, the smallpox vaccine is not widely available. It may be available in some government sources and investigational or referral laboratories, but it is not available freely. Second, in 2019 also, against the vaccinia virus of South Africa, a vaccine has been developed. Again, there may be issue of availability in these cases. And the treatment is, one is nutritional support. Patient has to be kept obviously in isolation. Nutritional support, IV fluids, and antibiotics so that the secondary infection does not happen. And third thing is antiviral medicine, Ticovirimet, which is also again not freely available, antiviral device. And the treatment of the symptoms. So the patient is having headache, so you may have to give the crocin kind of medicines, supportive treatment like multivitamins, and there is no steroid in these cases. Normally we don't give. As we have given in COVID cases, we need to augment the immunity of the patient and also support the nutritionally, that is one, IV fluids, and the treatment of the symptoms, like if he has fever, if he has headache, if he has body ache. So when you give multivitamins, calcium, that may also help. So this is a cocktail of issues, and the specific treatment is,
we have been exposed to a person who has been infected with monkeypox. What do you think they should do?
So that means somebody is exposed to a person, that means he can get infection. So he needs to understand that he may get infection. So he needs to be very, very careful for the earliest symptom. And maybe he needs to inform the local health authorities so that they also keep an observation on him. And I would rather suggest that he should be isolated, as we have done in COVID cases initially. Because monkeypox is a very fast-spreading disease. If somebody gets infected, then he will have to suffer with pain, headache, myalgia, fever, and lymphadenopathy, and these rashes. So, the effective screening, that's very important. And the early diagnosis of the symptoms. Fever is earliest. and watch for 6 to 13 days, which is the incubation period. So if the patient is not getting fever and something for next 2 weeks, possibly he will not get infected. So the crucial time is 6 to 13 days, where he should be observed, and if preferably if he can be isolated, he should be isolated.
Final message from your side to the viewers, to our viewers, to the healthcare professionals as well as the policy makers.
Monkeypox may be a rare disease at present, but yes, it can become endemic, it can become pandemic. We need to be careful in early diagnosis, early identification of this disease, so that we do not suffer, our people do not suffer in future with the monkeypox, having more and more people suffering from this, whether becoming endemic or pandemic. So we need to save the planet from monkeypox by being alert that yes, it is a disease which can spread like a wildfire. Thank you very much.
So we were with Dr. Anil Goyal Sarji. He is a senior urologist and financial secretary of IMA, Indian Medical Association. Thank you very much, Dr. Anil sir, for spending quality time with our viewers and answering all the questions. Thank you very much. We are really indebted to you.
Namaste from Delhi, India.
Thank you on behalf of and Aapka Dr. Bhaiya. We will be in touch with you. Thank you very much. Have a nice day. Gratitude.
Thank you. Bye.